The last two chapters in this unit, and actually for this semester for pharmacology, are chapter 27 and 28 on psychiatric drugs. Now, I was told that in mental health in the fall, that all the mental health drugs are going to be covered, so that I didn't need to cover it. But I looked over the blueprint for the Kaplan final that you have to take and pulled out what drugs were on there. So I went through these chapters. Some of them weren't even, but I put on here what is going to be covered on the Kaplan. So this is going to be very brief, the two chapters combined, just going through what you need to know. So this is the pieces you need to pick out of this. So antipsychotics, their action is blocking the action of dopamine. There's a typical and there's atypical. The typical comes in two groups, the phenothiazines and non-phenothiazines. As far as this semester, you'll learn more in mental health, but we're going to cover the non-phenothiazine called haloperidol. I actually did find a slide. This is Silent Night, Holy Night, All is Calm. After 10 milligrams of Haldol, oh, you must work in a hospital too. Thought it was cute, and I actually wanted to say, we used to say we needed some vitamin H, and I actually found a slide, I didn't put it in here, that talks about vitamin H, and that was Haldol, when we had somebody just going bonkers at night, totally off the wall. So Haldol, or haloperidol. So it blocks those dopamine receptors, treating acute and chronic psychosis and dementia. That's where acute psychosis, it comes in very handy for the ICU psychosis patient. It can treat schizophrenic and Tourette's, contraindicated neuroglaucoma, in severe sedation, severe liver, kidney, and cardiovascular disease, and blood dyscrasias. I combine things here, the side effects: sedation, headaches, seizures, EPS, that's extrapyramidal symptoms, dry mouth, blurred vision, photosensitivity, urinary retention, orthostatic hypotension. If you kind of look at this as like a cholinergic type of effect, interacts with increased sedation with alcohol seen as depressant, increased toxicity with any anti-cholinergic. Blurred vision. Urinary retention. That would be an anticholinergic. Sorry, this is the anticholinergic. That's why increased toxicity with an anticholinergic. Decreased effects with phenobarbital, carbamazepine, caffeine. I thought this was a good picture here, so I stuck it in here on some major adverse reactions. As you can see, weight gain is a big one. We're going to talk about, in a few slides, we'll talk about the EPS, and over here the neurolytic malignant syndrome. So, Haldol, take a break, the journey of psychiatric insight. Watch for these EPS, constipation, blurred vision, dry mouth, and some pictures of these, and the Tourette's utterances. You've seen this slide before with the EPS. I put it in here again. Make sure you know these: the pseudoparkinsonism, acute dystonia, tardive dyskinesia, akathisia. EPS is common with many pharmaceutical drugs. Neurolytic malignant syndrome, your text does go into it a little bit. There's this section that starts on just a paragraph that's on page 372 in your text. It is very, very rare. It says, I was started on an antipsychotic 2 to 10 days ago, increased heart rate, increased temp, increased or decreased blood pressure, increased respiratory rate, differential diagnosis of serotonin syndrome, anticholinergic. They have altered metastatus, rigidity, increased temperature, autonomic instability. There is a mnemonic here that I thought was good. It's called FALTER, F for fever, A for altered mental status, L for leukocytosis, T for tremors, E for elevated CPK, that's your muscle enzyme, creatine kinase, and R for rigidity. I thought that would be helpful. Okay, then into the atypical antipsychotics. The one that Kaplan has on it is your risperidone. Manages symptoms of psychosis and schizophrenia. Like a lot of the same side effects: sedation, headache, photosensitivity, EPS, seizures, dry mouth, weight gain, tachycardia, orthostatic hypotension, urinary retentions, sexual dysfunction. Very close to the other. I could not find anything in your text, but I did read some things that risperidone, another side effect is gynecomastia, which is the breast enlargement in the male. Contraindicating dysrhythmias, blood dyscrasias, liver damage because it is metabolized through the liver. And you will monitor liver enzymes when they're on it. Interacts with antihypertensive, increases the effects of antihypertensive. That means if they're on an antihypertensive, the blood pressure may be dropping. Decreased risperidone levels with concurrent use of carbamazepine. So it comes in several different forms here. Your text did talk about using a suspension when it's possible because psych patients tend to cheek their pills, put them in the side of their cheek, and then as far as giving it an injection, it must be given Z-Track, which I'm sure you have covered the Z-Track. I wanted to put it here, show you this picture, so because the medicine can be very corrosive to the subcutaneous tissue, so you pull the skin back, give the shot, pull your needle out, let go of the skin, and you can see where it zigzags so none of the medicine leaks into the subcutaneous tissue. These are some good interventions. I bolded some of the things about them cheeking, taking it with food or milk, not in an empty stomach. Give IM by Z-Track, that's in a deep muscle. Do not massage. Anytime you have to give a Z-Track, you certainly do not massage it, and you have to rotate injection sites. Do not allow it to remain in a plastic syringe. Administer within 15 minutes of preparation and may turn the urine a benign pink to red-brown. We've covered benzodiazepines before. The one I saw that is on the NCLEX, not the NCLEX, the Kaplan, is the benzodiazepine lorazepam, often known as Ativan. It is an often abused drug. To me, it's lesser than the Valium, but it can cause all kinds of risk of kidney problems, headaches, learning problems, physical and mental fatigue, memory loss, confusion, tremors. It's given injectable and oral. Yes, it makes them feel very happy. There is a tolerance. When they need higher doses, it is one of those things, recreational, people using it inappropriately must be withdrawn slowly, will have withdrawal symptoms, which are agitation, nervousness, insomnia, tremors, anorexia, muscle cramps, and sweating. But it also can take a while for these symptoms to develop. They may develop over the course of 2 to 10 days and can last for several weeks depending on the benzodiazepine's half-life. So these are withdrawal symptoms for any benzodiazepine. Withdrawal symptoms from long-term high-dose benzodiazepine therapy include paranoia, delirium, panic, hypertension, status epilepticus. Convulsions from withdrawal may be prevented with simultaneous substitution of an anticonvulsant. Alcohol and other CNS depressions should not be taken with benzodiazepines because of respiratory depression. Tobacco, caffeine, and sympathomimetics decrease the effectiveness of the benzodiazepines. Benzos are contraindicated during pregnancy because of tetragenic effects. There is a box on 384. Suggested treatment for overdose of benzodiazepines is given when an emetic and followed with activated charcoal, which you just covered in a previous unit. Administer benzodiazepine antagonist, which is flumazenil. I know it is Rumazicon, but flumazenil IV, if required. Maintain an airway. Give IV vasopressor for severe hypotension. So you're going to give an pressor to squeeze it to raise it up, because the side effect of the benzos may be of withdrawal is hypertension, and overdose is hypotension. Herbal supplements for depression. I know these two I've heard of are on the NCLEX. Ginkgo biloba is one of the herbs that is definitely listed on your Kaplan blueprint, so be familiar with this because it interacts with several things. The use of ginkgo biloba and many other herbal products should be discontinued 1 to 2 weeks before surgery. Some people do take it for depression. The patient should check with the healthcare provider regarding herbal treatments. Atypical antidepressant, which actually I didn't even see listed in this chapter, which is bupropion. That is one of the drugs on your Kaplan. It's very well known as Wellbutrin. Zyban is a once-a-day version that is used for smoking withdrawal. There's a bupropion twice-a-day dose. It's very good for depression. It is the only weight neutral and also has the least sexual effect, because most antidepressants will cause like an impotence, and this is the most sexually neutral and weight neutral of antidepressants, bupropion. It takes several weeks, like any antidepressant, to be effective. You take 2 to 4 weeks to start seeing it. It has very few side effects, but it interacts with alcohol, tricyclic antidepressants, and especially MAOs, which can cause acute toxicity. So the mood stabilizers, main mood stabilizer, we're talking about bipolar. The two that are covered on your Kaplan are lithium and carbamazepine. Know your therapeutic serum levels because it can be toxic. Treat manic episodes and bipolar psychosis. Interacts increased lithium levels with thiazides, methyl dopa, haloperidol, NSAIDs, antidepressants, theophylline, phenothiazines. So that's quite a few. I thought these were helpful. A mnemonic for lithium, it shows your lithium battery, and it has your LITHIUM. So your LI is leukocytosis, your T is tremors and thirst, polydipsia, H is hypothyroidism, IU increased urine output or polyuria, and your M is muscular weakness, mental disorders, loss of memory, decreased concentration. I thought that was a very helpful mnemonic. And signs of toxicity, especially at thirst, if your level is greater than 1.4. The shakiness, thirst, frequent urination, diarrhea, vomiting, drowsiness, muscle weakness, coordination problem, giddiness, blurred vision, tinnitus, seizure, slurred speech, decreased level of consciousness, possible death. More information on lithium, the nursing, monitoring vital signs, because you're very, very thirsty and sweating. You need to watch those sodium levels, watch for drug effectiveness, suicidal tendencies, which unfortunately can be increased with any of these psych medications. They need to drink 1 to 2 liters of water a day, which is quite a bit. They must take it with food because of GI irritation. Lithium levels checked every 1 to 2 months. The toxic is greater than 2, although they can be symptomatic of at 1.5. And here again is toxic side effects. And then the last one to cover is your chlorpromazine. You may know as Thorazine, but chlorpromazine is the generic. I thought this was a great mnemonic because it's used for multiple things: management of psychotic disorders, relief of intractable hiccups, management of the manic phase in bipolar, anti-emetic management of severe nausea and vomiting, management of adverse behavior disturbances in children. Avoid abrupt withdrawal may cause blood dyscrasias, dizziness, tremors, It's a powerful drug. It can cause drowsiness, blurred vision, hypotension, dizziness, decreased sweating, constipation, dry mouth, and nasal congestion. Watch for toxics and adverse reactions due to dose of blood levels, which can consist of the EPS, Parkinsonian symptoms, and tardive dyskinesia. This is a good thing on the pharmacology of it. Although it was initially as a local anesthetic, they don't use it that way. It wasn't as effective, so it can partial tolerance develops after chronic use. Reflex tachycardia accompanies hypotension. Arrhythmias may occur in overdose, especially with thorazine. So kind of look through these chapters, pick up what's ever on these particular medications, what you need to monitor for them, and the nursing interventions. So that is the end of this presentation. That's the end of this unit. That's the end of my lectures for this semester. Thank you.